All right, we do have a pretty packed agenda today, so I'm going to go ahead and get started and welcome everyone to the first Falls for Wisconsin Coalition's State Quarterly Collaborative of 2026. So while we're joining and people are getting on, if you wouldn't mind putting your name in the chat, and then a quick icebreaker, what is one goal that you have for 2026? And this can be a personal goal or a professional goal. So I'll go ahead and start. If you don't know me, my name is Suzanne Morley. I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging, and I coordinate the Falls to Wisconsin Coalition. And one goal that I have for 2026, oh, I have many, but the first one that comes to mind is I plan to walk 2 miles on my walking pad Monday through Friday while I'm working. So far, I've done it this week, not today yet, but we will see. It was a goal for last year too, and I didn't make it work, but hopefully this year. I'm just going to wait for some intros to come into the chat. Jill, one of Jill's goals is to take an afternoon walk break Monday through Friday. Laura, staying on top of birthdays and anniversaries. Yeah, that's a good one. I like it. Bringa, do strength training 3 times a week. Awesome. Paul, get outdoors more during the winter. Definitely hard. It's 40 degrees out where I am today. So today's a great day to get outdoors. Alyssa, read more. Another great goal. Marina, be more patient. Yeah, that's a hard one for sure. Tina, continued education, completion, and quality improvement. Awesome. Shari, drink more water. Yep, another great one. Courtney, keep active. Yeah, lots of really great goals here. Exercise more. Lots of goals related to activity, which is great and great for health prevention as we age. Well, thanks everyone. Feel free to keep dropping those in the chat. We are going to talk a little bit about engaging men in programming. So we have a couple of guest speakers that will be sharing a little bit about what they're doing with that. And then we'll have some open discussion related to that topic. And then we're going to talk a little bit about the Falls for Wisconsin Coalition Quick Guide, which is up for updates for this year. And then we have lots of state updates, lots of exciting things happened at the end of 2025 and lots of exciting things coming in 2026. And then hopefully we'll have some time for local updates and then we will wrap up. So before we move into the slides for Michelle, Shari, I'm going to let you go ahead first if you want to. And Shari is going to talk a little bit about what they've done at United Community Center and having some successes in engaging men in programming. So Shari, take it away.
Thank you. Thank you, Suzanne. And good morning, everyone. I didn't want to do a PowerPoint just because I am going to talk a lot about the experiences that we've had in different programs and how we've worked with our population. So before I start, I wanted to share a little bit more about what I do and where I work. I'm the director for the community engage and research here at United Community Center. And United Community Center is an organization, a nonprofit organization that works mostly with the Latino community in different areas. And we serve all ages, from babies to older adults. So we have a program that serves 6 weeks old babies, and our oldest is, I think, 102. So it's a very interesting way of being able to meet the whole family and understand the needs of the whole family. And when we do programming and when we do research, we keep that in mind. As I mentioned, the type of work that I do involves community engaged research, which allows us to hear from the community specifically what they need and create programs and research projects about the community needs in terms of not only the topic, but also involving, what are the specific questions that they have, the methodology that they want to use, want us to use, and also how we are going to go back and share everything that we learn through the research project. And then with the health programming is the same thing. When we're creating something, we're always keeping in mind what the community told us that they needed. And that has been key, I feel, in terms of recruiting specific populations and groups like men. So something that I think most of us have experienced is that historically, it's hard to recruit for research projects, especially in underserved communities. And when we have programming, sometimes it's a little bit easier than research, but at the same time, we also find a lot of challenges to be able to recruit some of our populations. So it is known, and I'm pretty sure most of us have experienced this, that usually we have a program and we open it up, and most of the participants that show up are women. And we are kind of frustrated in terms of what are we doing wrong and what do we need to do to be able to recruit men to join different programs. So something that we've learned during the different projects that we've had is that is the key to meet the population that you want to target where they are. And I know everyone says that, and I know it's like, okay, but I don't know where they are. And I feel that something that was very a learning opportunity for me in my career was to be able to sit down and talk to people after COVID happened. And I kind of like try to learn what worked and what didn't work. And that was one of the main things that we noticed in our first COVID project was that everyone that was getting the information were moms, were grandmas, were daughters, but there was no participation from males. And something that one participant I always remember that told me was that they were busy trying to keep up with what they needed to do to support their families in terms of going out and working and all of those things. And I'm not saying that woman doesn't work, but it's just something that he shared in terms of the pressure that he felt. When he told me that at the beginning, I was like, I didn't quite understand. But then later on, I saw that, and I'm talking specifically about the Latino community in this specific project. Most of them, when we were doing programming, we were trying to do programming in a specific hours. And we were like, well, let's do it after hours. Let's do it at 5 o'clock. Let's try to see if that helps. And it wasn't working either. And then I talked to another man and he said, well, the thing is like, I'm super tired. I have a very hands-on laborious job that doesn't allow me to do that. And to be honest, I'm not going to be sitting down in a place and reading something that it's going to take time because I'm tired. And we started one of our first projects that we still currently have was a radio show. And it was specifically targeting males. And it was because we sit down with the community and they told us, well, we're working, we're driving, we're out in the community, but we always listen to the radio. And that's why we started a radio show, just to be able to connect with them. Another thing that we saw was that once we were able to connect with them and they were part of, we had different projects, but they were part of our projects, we realized that we had a lot of males having difficulties in terms of mental health. So a lot of them, and this could be because of cultural taboos and all of those things, but they felt that they needed to be strong for their family, and they were dealing with a lot of anxiety, a lot of different needs, but they weren't expressing that. And then when they started to participate in our research and our programming, we had programming about diabetes, we had programming about heart health, we had programming about mental health as well. Many of them across the different programs shared, I'm dealing with this emotional issues and I don't know what to do with it. And this is impacting this, and that. So just to give you an example, we have a current project that is about diabetes management. That one is a research study. And we did saw the pattern, pretty quickly. There were more women than male. Just to give you the numbers, we have enrolled 127 participants. And at the beginning, most of them were women. And we were like, okay, we need to do something different. Right now, the numbers look like 73 women and 50 men. And that's a good number, to be honest. When we look at that, we also have some people that didn't identify as any of the genders. But what we saw with our participants was that they felt comfortable to share and to participate because we were very, very flexible in terms of times and in terms of where they needed to go to participate. So we utilized community centers to be able to meet with them. We also meet with them either very early in the morning or very late in the afternoon. And I think one of the key things with that one was that we were available over the phone. So many of them had shared with us that that was a key factor just because sometimes the routine changes and sometimes they were very tired and they knew that they could call us and reschedule or call us and just talk over the phone instead of coming in. So that was something that was key in terms of being able to work with them. The other part of the other project that we had was a project about heart health and another one that we had about vaccines. And that was for the flu vaccine. And in those two, something that we noticed was a lot of them were coming in to just listen to a class, and we ended up talking a lot about the different challenges that they were living. And that included transportation, and that included housing, and that included family dynamics. So we realized that we needed to have more time to be able to sit down and talk to them just because there was a lot of things that they needed to just talk and kind of like get it out of their systems. And then the other part of it was to be able to support them and at the same time allow them to have someone from their family, it could be wife, it could be daughter, to be their support person because a lot of them had a female in their lives that they felt that they had everything under control for them, and that was the only thing where, in terms of health, and that was the only thing that they needed to have them um, to have them be aware of everything that they were doing. Just because it was like, okay, yes, I want to participate, but let me talk to my wife. I want to participate, but let me talk to my daughter because she knows about my appointments. She knows about what medications I'm using. She knows about what insurance I have. So all of those things I think are very important in terms of working with them. And of course, all of those things that applies to both men and female in terms of language, if they speak another language, in terms of taking into consideration society and the challenges that might be happening. And I'm going to stop now because I think I already talked for 10 minutes.
Well, I think that was really great insight, Shari. Thank you so much for sharing. If there's any questions, feel free to come off of mute or drop those in the chat. But it's kind of sounding like, you developed that radio show for the men specifically, which is a great way to provide information to them. And then, providing different hours, after hours, or before, and having that open communication and also considering their mental health challenges. So thank you so much for sharing those insights.
Thank you.
I have question. Thank you so much. That was super helpful to hear your approach and flexibility. And I think all of us can benefit from trying to look at those different angles. One of the things that we've talked about as well is a radio show or station. How did you go about setting that up and maintaining it? What were the avenues that you used to begin that?
So we submitted a grant application for the Minority Health Program is our current funder. And basically we described the specific things that we wanted to do and why we wanted to do it that way, which was, that conversation with our community. And then when we created the show, we contacted the local radio station that the community members mentioned. At that moment, there were two radio stations that were specifically for Latinos. And then we asked them, which one will you hear the most? And that's where how we decided to go with that one. And then also we did had males being part of our advisory group because they were the ones that were telling us, oh, this is a topic that will be interesting for them. You should talk about this, you should change this. And that way we, just to make sure that we were doing what they wanted and not what we thought it was interesting.
How often does it run and is it continue? Is it
Every
ongoing?
week.
Okay, great.
Yeah.
Thank you so much.
Thank you.
I think you said something really important there too, having the men part of the advisory committee, because we can't say what they want. They need to say what they want. Thank you. All right, Michelle, I'm going to go ahead and share your slides. So feel free to go ahead and get started and introduce yourself. And you are muted.
Here we go. How about now?
Perfect.
Wonderful. Good afternoon, everybody. My name is Michelle Urban. I am a program manager here at the Brown County ADRC. A little preface on this program that we're going to talk about quick today. When the Medical College of Wisconsin came to St. Norbert College here in our community, we were lucky enough to be engaged right away with the college and their programming. There was a provider who's one of the faculty at Medical College of Wisconsin, and he has a very good relationship with the ADRC. So one of the classes that these new medical students get initially, their very first year that they're here in medical school, is community health. It's a community health program. And so the whole class of new students that come in, ADRC as well as other agencies in the community who provide community health are able to come and talk to the students about the things that we do and the programs we provide and services. And so what we do as an agency every fall when this program is launched with the new batch of students, we come in and present, here are the things we do, and here's where we could use help. And that's how we are able to get medical students to help us with these research projects every year. And we probably have 3 of them going right now, but the men's engagement is just one of those. We have 3 of them going. So that's a little history about us. We are lucky enough to come in, be able to present where we have some needs, and then the students help us select the research project they're interested in. So next slide. So as far as the project, you know who the players are here at the ADRC as well as the MCW students. And it's led by 2 medical students. This particular project, 2 men came forward and said, we're really interested in this. And it was really great to see because it had to do with a lot of family experience. They saw the things that their fathers and or their grandfathers were doing that were frustrating to them as new up and coming providers, that they wanted to engage their family members more. So it was the personal connection that they really were interested in. The project itself will run as far as collecting the data. It's going to be from spring of 26 here. We start in April and it'll conclude about October and April. And that's when we'll disseminate and they'll assess all the information and then provide us with the final summary. Next slide. So some of the things we want to try to achieve, we really want to, through this survey, we're assessing interests, needs, what are the barriers for male participation in health programs, asking all the good questions. We want to understand really why men do or don't engage. Because here at the ADRC, we probably, it depends on the program, of course, but we probably have 10%, maybe 15% of men that engage. Otherwise, it's mostly women. So it's probably similar to what many of you are experiencing, but we want to try to identify those effective ways to reach and to motivate men to get engaged in some kind of program that would help from a health promotion standpoint. And then we've obviously looked and paid attention in the last couple of years to the successful programs that are happening around the state. And we've made note of the men's shed model, but there's other models too that are successful. So we want to take this information and then overlay it to what might be the best program, but not necessarily having to reinvent the wheel. If we end up finding that these men want to do something that's existing already, we'll adopt that. Next slide. So as far as how we're going to collect, what are we going to collect? It's a male-focused survey. It's really specific on social, nutritional, prevention programming. The options for the survey will be hard copy and or electronic copy using the QR code. And then the young men from the medical college will be entering that into Qualtrics. So that's how we're going to assess the data we put into Actual. We're going to shoot for a minimum of 50 men, a maximum of 200. And then the surveys are going to be sent out through our software system to our male customers. We also have some players on our different coalitions that the ADRC is involved in. We're willing to help too. So in our local area, the De Pere Health Department said they will assist us as well and send out to their male customers, as well as our Salvation Army Croc Center also. Next slide. And then we're going to do 2 in-person focus groups, a minimum of 2. We'll do more if we need to. But we have a woodworkers group here that's all been, and we know that that would be a great population to talk with. And then we also have 2 support groups, the Dementia Men's Support Group, and they actually meet out in the community at a local restaurant once a month. So we're going to go, the 2 young men who are the MCW students will go out and do these interviews with all 3 of those groups there to get some face-to-face information. And then I saw Paul's on the call today. Paul is part of our Falls Prevention Coalition member, and he's going to help us too. He's got a great perspective being a male, and he also is active and does health promotion for his own life. And then he's had some experience too, working with some other research projects. So those relationships on coalitions are really helpful too, because it allows us to get to a larger pool of folks and then have some one-on-one. And then we're also going to be, the young men are going to organize from some of this data too, but they're going to provide some health-related workshops that are going to be organized and led by male healthcare providers. So that's something that they're going to help us move forward to based on what we end up finding in our information. Next slide. Yeah, so the outcomes we're hoping for here that we're going to get some recommendations. You know, what are the topics? What are the areas that men are looking for in our community? What are they hoping to learn more from? And then what's the format they want to receive that information in? And, you know, obviously how we speak to men and what we say to them, we need to figure that out better because currently we're not getting the men in the programs, you know, so we need to figure out a way to talk to them the best with marketing strategies and what does that look like? So that's part of the questions on the survey. We want to understand what motivates older men to participate, that kind of thing. You know, is it a teaching model where they like to learn from one another because they're actively doing another activity and then the health related information can just come along with that? So we're hoping to kind of nail that down a little bit more clearly. And then obviously we want to have data to strengthen our prevention services for the men that we serve in Brown County. So that's kind of our approach. We're really excited. I think one of the nicest things, you can do the next slide, but I think that's it, right? Yeah. So I think one of the nicest things with this is the fact that we have 2 really passionate young men who are going to be providers. And I think when men are visiting with men, there's a different level of comfort than women, you know, going in front of a group of men and asking questions. It's just a different experience, right? So we're really excited about that and to see where it goes. The other thing that's kind of nice about the MCW research projects that we do is we have a continuation with many of them too. Because we do this over time, we might be done with a certain group of students, but the next year, another group of students come in and say, hey, can we add on to that research? We'd like to tweak it and learn a little more about this facet. So we're hoping that we'll have a little momentum with this particular research project to go even further past the first year that we're trying it with the MCW students.
Awesome. Thanks so much for sharing, Michelle. I think we'll all be excited to see in fall or winter of 2026 what the data shows. And you all learn in Brown County from the men that you survey. So super exciting that you have that research project happening.
Mhm.
And if there's any questions for Michelle, feel free to come off of mute or throw those in the chat. And I will say, when we were planning on putting together this quarterly collaborative meeting focused on engaging men in programming, we at the Best Practices Work Group for Falls Free, Wisconsin reached out to many different organizations asking, hey, have you had any successes with this? And we did hear a lot of no's, but we want to learn more from the group too. So I wanted to open it up for discussion. And I have a little Menti set up. So you can either scan the QR code on your phone here, or you can join at menti.com and enter in the code. So I'm going to drop that in the chat. And then if you have had any, successes yourself in your organizations in engaging men, or if you've heard different things from older men or different strategies, I encourage you to drop those in the Menti. And I'm going to pull that up. Okay, and there are a couple different slides in the Menti as well, so just stay on the first slide here. I just want to hear if you do have any approaches that you've used to engage older men in programming. Create an advisory committee that includes men. Love that strategy. This is a challenging one. I think it's something that we've all kind of thought about and talked about quite a bit. So I see this is something we want to work on this year. We rarely see men take stepping on, usually only when their wife drags them along. I mean, it's something I actually looked at with our stepping on facilitators in Wisconsin to see how many facilitators themselves are male. And there's not very many male facilitators either. Which I think is something that we see across the board in a lot of the fields that we're in as well. We'll leave it open for a little bit longer. Hopefully there's maybe one or two more strategies that people might be able to share. I know I've heard of some organizations kind of partnering, and not for stepping on specifically, but having I think it was Healthy Living with Diabetes, maybe in a tribal community that did a veteran specific healthy living or with diabetes or healthy living with chronic conditions. So maybe trying something like that. The men's shed. Yep, I'm going to be presenting to our men's shed on falls prevention and stepping on and see if that increases male participation. So the men's sheds throughout the state are a really great avenue to reach men. I think this would be a great goal to work on and try to recruit more men to our coalitions. No strategies to share yet, but definitely feel like the radio approach is key. Seen a lot more men in my Tai Chi workshops recently, and that leads them to other programs that we offer, such as Stepping On. We have thought about using approaches that target veterans since there's a higher number of males who attend veteran-specific programming. So that might be a good approach to try. Well, I think this is just maybe something to kind of keep bringing up in the work that we all do and keep trying to think of different ways that we can approach older men in programming or reach out to them in different ways. And I think we'll all be excited to keep learning from Michelle's research project in Brown County, from Shari in Milwaukee. And if you do find anything, if you try anything and find it to be successful, I'll be happy to hear that as well. Okay. Well, thank you, Shari and Michelle, for sharing. Again, if you do have any other questions, feel free to drop those in the chat, but I'm going to move on to our next item on the agenda. So our coalition quit guide. If you haven't been aware of the Coalition Quick Guide. This is something that the Falls Free Wisconsin Coalition developed back in 2022. And it did go through an update in December of 2023, and it's due for another update. So we have a couple of different ways to access the Coalition Quick Guide, and this is really meant to guide local communities in developing, maintaining, or sustaining a local falls coalition. So throughout Wisconsin, there are around 11 local, typically county level falls coalitions that I'm aware of. And we know that there are some coalitions that have used this Coalition Quick Guide, developed a coalition, but we wanted to go through it and then ask a couple of questions about the Coalition Quick Guide. So I'm just going to share where it can be found on the Falls Free Wisconsin website and then just briefly go through a couple of details. And I'm going to go back to the Menti, so keep that up if you have it. But it is here on the website under For Professionals Start a Coalition. We put it in this interactive format in 2023 when we updated it. So there's this interactive format, but then you can also, if you'd like to look at the PDF version of the toolkit, and there's a couple different, so there's just the introduction, getting started, forming a coalition, starting and launching a coalition, the maintenance phase, the institutionalization stage, and sustainability. And then we have some different case studies here. I'm just going to show and highlight a few different things that you can see. So we kind of start with painting the picture with some data. We talk about the Falls Free Wisconsin Coalition, the benefits of coalitions, recommendations for starting a coalition, then the formation state. So reviewing state and local plans, identifying key partners, making the case for falls prevention. So again, that data piece is super important. Understanding your community characteristics and existing programs, creating a planning group, and then developing those foundational documents, strategic planning. Again, you can see there's some examples here from Milwaukee County and Brown County, how to recruit and engage coalition members, suggested organizations to recruit for the Falls Coalition, planning that kickoff meeting, and then, meeting formats, coalition communication, identifying key objectives and actions, and then the sustainability piece here. So engaging additional members, the importance of those different members, regular communication, sustainability and funding, sharing the work of the coalition, the community, there's social media resources in here, and the different ways to stay connected. And then it kind of goes into the appendices, learning from an urban county falls coalition, learning from a rural county coalition, and then other activities like September Falls Prevention Awareness Month activities. And then I'll just jump in here so you can kind of see how the online version looks, but it's all the same information, just in a different format here. So going back to the Menti, I'm going to pull that back up. Wanted to ask a couple of questions related to the Coalition Quick Guide so that we can update it. So it's looking like there's a different code here. So you might be able to stay on the same one. Otherwise, you'll go back to menti.com and then enter the code in the chat. So the first question here is, I was aware of the Coalition Quick Guide, yes or no? Give maybe 10 more seconds or so for this question. All right, so it's looking like almost 50-50, a little bit more yes, but still some no's. Then I'm going to go to the next question. So if you have, first of all, if you're aware of the Coalition Quick Guide, but if you've utilized the Coalition Quick Guide for guidance to either develop or form a coalition, make the case for falls prevention in your community, recruit and engage coalition members, identify key objectives and activities, Maintain a coalition, sustain a coalition, and learn best practices from others. So if you have used the coalition quick guide, what have you used it for? Give maybe 10 more seconds on this one. All right, so it's looking like the majority of people have used it primarily to learn best practices from others, which is great. And then if you do, if you have used the Coalition Quick Guide, feel free to drop in what sections of the Coalition Quick Guide that you found most helpful. And then if you have any feedback on what sections of the Coalition Quick Guide maybe need some more information, or you need clarification on, for example, how to sustain a coalition or how to recruit coalition members. Leave this open for just a little bit longer. Yeah, I have viewed all sections and like the suggestions for starting one and all the stats, the images and samples that are provided, takes the deep thinking out of grading from scratch. Yeah, that's great. No, we have a little bit of a smaller group today, so I might not get too much feedback here, but looks like overall it was very helpful in starting my coalition. I'll be using it again in 2026 to start another. Awesome. Yeah, it's been super exciting to see the growth of local coalitions throughout the state in the last few years or so. Okay, well, I'm not seeing any more comments come in, but if you do have any comments on the Coalition Quick Guide, I'll send a follow-up in the email that comes out after this meeting. If you do have a chance, maybe if you haven't looked at it in a while, or if this is your first time hearing about it and you want to learn more, definitely look through the Coalition Quick Guide and see what sections you think are helpful, or what sections look like they might need a little bit more information added to them as we look to update this. And then just have one more question, I think, on the Menti, maybe two more. And again, feel free to just drop these in the Menti or drop them in the chat. But as we kind of talked about earlier, wanted to just chat a little bit about what you've done to reach underserved populations in your community, or to reach underserved populations in your community. Have you looked at Lift Assist data? Have you tried reaching out and engaging men in programming? Have you reached out to underserved communities? What sorts of things have worked for you that you've done to reach those underserved populations? Okay, I'm not seeing any responses come through for this one, so we'll go to the next one. But what programs and practices have you implemented in your community? So are you doing stepping on? Are you doing mugs for rugs? Are you doing any EMS referrals to the Aging and Disability Resource Center? Are you doing Falls Prevention Awareness Month activities or events? What sort of activities are you currently doing related to preventing falls? All right, so I'm seeing stepping on EMS referral programs and outreach events. Stepping on strong bodies and outreach events. Stepping on bingo size, mugs for rugs and outreach. See some comments in the chat. EMS jot form referrals to ADRC, stepping on annual events with Coalition, medication management program and workshops with local pharmacists, bingo size, stepping on walk with ease, EMS referral to ADRC, online professional referral, 1 hour falls prevention program by Coalition members and outreach events, stepping on, steps to safety is going to be implemented this year, stepping on outreach, fall prevention week awareness, stepping on Tai Chi, EMS referrals, PALS, and falls prevention community fairs, Project Echo case-based educational series will support underserved and rural communities as well as anyone interested in attending. It looks like that was for the last question. Community-based lunch and learn events in collaboration with EMS and Safe at Home, as well as stepping on an annual September only leashed fall event. Awesome. So it's looking like lots of outreach and educational programs, lots of stepping on and other evidence-based programs, and looks like referrals as well with ADRC and EMS, which is great. Okay, well, thank you all for participating. I appreciate it. This kind of helps us with the update of the Coalition Quick Guide. We'll probably send out some additional information to gather some more feedback, but as we look to update it, we want to add more of these best practices into the Coalition Quick Guide so that it's helpful for those that are looking at it. Okay, I'm going to pull us back up to some updates now. So lots of Falls for Wisconsin Coalition updates. This one will be coming out tomorrow with a recording of the webinar, but we do currently have this on our website. The Coalition developed this at the end of 2025. And it was something that we wanted to do so that falls prevention isn't just a September thing, but it's something that we can develop different campaigns, either social media graphics, newsletter articles. We can talk about these topics on the radio, press releases, whatever it might be, on a number of different topics. And you can see on the screen that some of those topics relate pretty heavily to preventing falls. They're the things that we talk about pretty frequently. But then there's other fun ones like National Superhero Day that are just fun, different ideas and ways that you might be able to develop some messaging related to falls prevention. So it's currently on our website on the promotional resources page under For Professionals Promotional Resources. And it's linked right here at the top. So if you click on this link, you'll get to the whole 4-page document. We have anywhere from like 3 to 6 different ideas for each month. And then there's different links in here as well. So if you just click on a link, for example, it'll lead you to either an external source or an internal article that was already developed. So you can get some ideas and kind of, you don't have to recreate everything, but hopefully this is helpful for you all so that you can continue to talk about falls prevention and have some different ways to talk about it throughout the year. The next update is our next quarterly campaign. So it's coming up within the next month or so. So we've had lots of conversations with the coalition, and I know lots of local coalitions have been talking about hoarding. So we're super excited to have Carla from Catholic Charities talk about hoarding during one of We Has Age Well series webinars, and we're partnering that with the coalition. And then we'll provide some additional information about preventing falls towards the end of the webinar. But this is a webinar that's open to anyone. So it's open to older adults throughout the state. Professionals are welcome to attend as well. So we have a few different versions of the flyer that you can share, and I'll share where those are on the website, but definitely feel free to spread the word about this one so that anyone that wants to learn a little bit more about hoarding can do so. And that goes right in conjunction with our next quarterly media campaign. And that topic is that we have messages around forwarding, but then we have also have messages around home safety and a few messages around caregiving as well. So we have a newsletter article and press release that are ready to be customized and used. And then we also have 8 different social media graphics and messages that can be used as well. And you can find those on our website. Again, on the promotional resources page, and they are linked here under the 2026 winter campaign. So we have the social media schedule and graphics, the customizable newsletter article and press release. And then we have different versions of the consumer webinar flyer. So one has a button where you can click on it electronically and register. There's another with a QR code, one with a link, and then another that is blank at the bottom. So if you are interested in hosting a watch party, for example, you can add in that local information towards the bottom. A couple other updates are we also developed this 3-page bone health and falls educational resource. So this is something that we had intern worked on earlier last year, and then our coalition members took and plugged it into this nice little handout. So it includes a couple of different ways to use it. And I wanted to share those here. So the first 2 pages of the document are for consumer education. So it talks about preventing falls and fractures, ways to do that on the first page. And then goes a little bit more into what osteopenia and osteoporosis are on the second page, and then some resources on bone health. And then there is a 3rd page that is meant for provider education. So there's links to recommendations and resources for bone health and falls. For example, looking at local prevalence data, referring patients to community exercise programs, and then there's some data towards the bottom that providers can see the prevalence as well nationally. So with that, we have a companion document that can go along with it, whether you're using the first 2 pages of the document for consumer education, or if your organization wants to share some messages on social media. We developed 3 different social media graphics that can be customized. So there's this nice white space here next to our Falls for Wisconsin logo that you can add in your own logo if you'd like to do that. And we have instructions for how to do that in a Word document as well. So you're not alone. You don't have to try to figure it out all on your own. There's some instructions here for how you can add in your own logo into the blank space. And then there's this 3 social media graphics with the suggested. I've already seen someone share these on Facebook. I don't remember who it was now, but I know someone already found these on our website and started sharing them, which is great. So again, you're more than welcome to use just the consumer resource guide, the first 2 documents, or partner with, local healthcare providers or other agencies that might be a benefit from that 3rd page, the provider education. Okay, and I think that's the majority of the updates, and I'm going to get into the most exciting one, in my opinion, now. So again, we were very busy at the end of 2025, but we're going to be very busy at the beginning of 2026, and we're super excited to announce that we're holding a summit, and we're calling it Advancing Resilience, a Falls Prevention Summit. It's 2 half days, and it's on April 21st and April 23rd. We don't have the agenda finalized quite yet. I'm hoping to have that finalized by the end of this month or early February. But we'll be talking about different topics. We'll have different speakers related to things like falls resiliency, different falls prevention programs, nutrition, and how that relates to falls prevention, how to talk about falls with older adults. We're going to have a panel discussion on that, and we'll have an older adult on that panel as well that we're super excited about. We're going to be talking about the 4 M's framework, some different innovative technologies that are available for falls prevention, medications, another hot topic, and then cultural competency with programs. So you can register for the summit. It is on our website. Again, we don't have the full agenda out yet, but we will soon. And then we also have a sponsorship opportunity for the summit. So if you or your organization would like to sponsor, we have a couple different sponsor levels. for the summit, and you can find all of this information on our website. We have a new summit page under For Professionals Summit. So you can see the sponsorship opportunity document right there. And then you can go ahead and register by clicking the link in the flyer for the summit. So it is a 2 half days. You can attend just 1 half day, both of the half days, and then they will be recorded as well for later viewing. So this is something we've wanted to do for a while, so we're pretty excited that we're going to be able to host this in April. Okay, just a few other quick things that we are hoping to learn a little bit more about. This is for our Falls Free Wisconsin best practices work group, but we are currently working on providing some education related to screenings and strength and balance assessments or gait assessments, like the timed up and go, the 30-second chair stand, and the 4-stage balance test. So we are wondering if anyone on the call or anyone that is viewing the recording is doing any pre-post assessments with specifically the Stepping On program or other programs like Strong Bodies, Tai Chi, Bingo Size, any of the other falls prevention programs using these 3 specific assessments. So if you know of someone that's doing this, or if you are doing this, definitely reach out to me. We would love to learn a little bit more about what you're doing so that we can use that as an example for others. Okay, and I have one more ask before we turn it over to local updates. I'd really appreciate it if everyone would be able to take our year-end survey. This is super helpful as we move into 2026, fast and furious. Just wanting to get some feedback on our 2025 activities. And then we have some additional information on, you can provide feedback on different things that you would like to see the Falls Free Wisconsin Coalition do in 2026 as well. So the QR code is on the screen if you want to take a screenshot of that and then fill it out now, fill it out later, or click on the link. I'll try to drop that in the chat too, so then you can have that up and complete the short survey. It should only take 5-10 minutes or so, but it'd be super helpful. All right, and with that, I'm going to stop talking and turn it over to local updates. So if you have anything that you're working on currently, any upcoming events, questions, challenges, successes, or resources to share, feel free to drop those in the chat or come off of mute. Give it maybe 10 more seconds or so. It's kind of hard. The first year of 2026 already pushing all these different things at you. So
I know I tried to drop it in the Menti that we were doing, but the Project Echo, we're getting closer to launching that. So it'll be most likely a cohort where you can join and then there could be credits available at the end of it. But we've kind of narrowed it down to 7 or 8 topics after we did the needs assessment. So thank you for those who filled that out, because we're going to continue to gather information. Nothing is set in stone yet, but the topics that we have so far will be fall screening with a 5 M's approach. So it was 4 M's, but also we have the 5 M's from the CMS, but mobility and resources, evidence-based exercises, polypharmacy and medications, alcohol use. These are all the different series that we would run. So each week it would run with these different topics: dementia and cognitive impairment, and I can share all these as well. Caregiver resources and safety, fall prevention for patients with multimorbidity, and home safety and social isolation. So I'll continue to update the group as we get closer to launching that, and then how to register and hopefully get the word out. But our goal, obviously, if you don't know Project Echo, it really is a wonderful platform for reaching. It's global, so it can, obviously we're going to start small and realistically start within Waukesha and Milwaukee, but also anybody in the state, anybody can join if they're interested. So just really looking to get to the rural and underserved communities with this information. So thank you so much.
Thanks, Melanie. Any other updates before we close out? Oh, yep, Margaret, I see your comment in the chat. The Orthopedic Nurses is holding a conference on February 12th. They will be in the newsletter tomorrow. So the registration link will be in the newsletter that's coming out tomorrow if you're interested in learning more about that conference. All right, so I'm not seeing anything else, but I wanted to thank you all for the great work that is happening in 2025 and all that is to come in 2026. We have a jam-packed, lots of information in the newsletter coming out tomorrow, but we have 2026 meetings on the screen, April 9th, July 9th, and October 8th. And just wanted to thank our sponsor, UW Health, for supporting the Falls Free Wisconsin initiative and all of the work that we all do. So if you do have any questions or feedback and want to reach out, always more than happy to get that information. Otherwise, we'll see you at another meeting in the future. Thanks, everyone.